Assalamu alaikum, ladies and gentlemen. Welcome after a very long break, an installment of CxO Global Forum's Health Tech show called Health is Wealth. The topic for today is health tech and consumer marketing, and we have with us a very budding health tech entrepreneur, Dr. Maida Affan. Assalamu alaikum, Dr. Maida. How are you?
Assalamu alaikum, Bilal. I'm good. Thank you for the opportunity. It's a pleasure to be here.
Likewise. This episode is brought to you by ActiveKey, a budding health tech insurance platform based out of the States, working on the specialty pharmacy front to provide customers ease of access in purchasing their medicines. And interestingly enough, it was founded by two Pakistani Americans. So that's something that as a nation we can be proud of. So I'd like to get started with our first question. So naturally, when I get guests on the show, I asked them about what's motivated them to, pursue this particular field of health tech. Healthcare, as you could very well imagine, is a very difficult field to go into. There are a lot of barriers to entry, especially in a place like Pakistan. And it's no surprise that we find people who actually have a background in medicine come into health tech. So I'd naturally like to ask you what your background is in medicine and what inspired you to go to the specific field that you're in. And naturally, a follow-up question of it would be what Xeven Health is and what your role in it is.
Yeah, no, I get that question asked a lot. It may not be as nicely stated or as posed as you have, because I usually, people ask me, well, why are you doing injustice with your medical profession and why are you working in a hospital? And I guess the concept of a doctor working outside of the hospital is still very, I guess it's not digestible or it's not taken well, or maybe it gives the impression of a clinician or a physician being disloyal to one's career. But so I'll tell you a little bit about my background. I am a general practitioner. I graduated in 2010. And after that, I briefly practiced as a general physician for 1 or 2 years. And then I was on my parental leave. I got married, I had kids. And while I was on my parental leave, obviously, doctors can't sit idle because they're so used to a busy life. So I joined a US-based telemedicine company. And this is 5-6 years ago, right? So this is before health tech boom. This is before the pandemic. This is before telemedicine was very normal. And so while working with them as a clinical content strategist, and then that sort of role expanded into digital marketing, I really found that I could apply my clinical knowledge, my healthcare knowledge elsewhere, and that I was able to apply it outside of the hospital as well. And to cut short, over the years, that's where I sort of was able to form a niche for myself in healthcare marketing and communication.
It's a very detailed, but also at the same time, very concise answer. As you know, these shows normally come with a time limit. And I'm glad you actually were to explain your whole story in a lot of detail in a very short amount of time. So the second question comes, naturally after talking to a lot of people that I know in the advertising space. And nobody really wants to go into marketing for healthcare products. And I have a friend who went to school with me who runs an advertising agency called Dojo Supermarket in the States. It's a contract with Adidas and a few budding brands, who continuously jokes with, during every single interview of his, that healthcare is where marketing companies or marketeers go to die.
Yeah.
So, even with my background in e-pharmacy, I found that there are a lot of barriers to promoting medical products online. First of all, you can't really promote allopathic products. So then you have to go into consumer-oriented or herbal or, products that aren't necessarily of a, typical pharmaceutical nature. So the second question is, in your opinion, what truly gauges the consumer to purchase a medical product? Is it an impulse buy? Is it something that he will understand the lifetime value of, and then he'll be a customer? How does it work?
Yeah, no, excellent question. Well, first of all, I think the landscape has changed so much after COVID, especially. When we see other industries, Bilal, adapting digitization, adapting digital sort of routes of communication for consumers. We need to understand that the same shift in consumer behavior is also happening in healthcare, right? So I guess the first thing is to realize that actually the patient, after so many years, is in the driver's seat, is in control, and is actually, driving the digital transformation, not only in product design and development and health tech and, telemedicine, virtual consultations, but also in the marketing perspective. Now, I know, I say this all the time that healthcare is a unique sector. You can't compare it to other sectors or other, for instance, the travel, industry or the retail industry, because it's unique, because there's so many regulations, because there's compliance issues that you just mentioned. But there are ways around it. And this is why, I tell my clients and healthcare organizations that they need to, first of all, understand the shift in consumer behavior and treat the patients as consumers, number one. Number two, they need to meet the patients where they are. Now, when you're saying about needed consumers to purchase actually, or, to purchase medical products, first of all, it's need. The patient is going to see whether they really need the product and whether they really need the product. And if they do, they're going to see, well, whether they have access to it. Again, I'm talking in a context where technology is being leveraged here to access the patients and to provide all this information to the patients. And then whether it's affordable, right? So that is actually the key, I think one of the key factors that actually incites the patient to make a decision, whether it's affordable, it's accessible, and it's convenience, right? Especially in this sort of age of economic inflation, they're going to calculate their fuel prices now. They're going to calculate their other costs that are going to be incurred, while purchasing this product. So again, if it all comes together, I think that, if your consumer is out there purchasing food, ordering food online through apps, if they're ordering, watching Netflix, entertainment, they're shopping online, there's Zameen.com, right? Like they're purchasing real estate online. Why not healthcare, right? And within staying within the regulatory guidelines and within, keeping in mind the compliance issues, I absolutely don't think that healthcare is where marketers go to die. I think this is a big opportunity for marketing experts.
Absolutely. I could never relate to my friend when he said that, maybe because I come from a healthcare background. I loved, going to different pharmaceutical companies and discussing different collaborative ideas with them. And that comes on to my next question. What would you say some of the challenges you faced when you were trying to provide such services to healthcare brands?
So this is a sore point, right? This is a big pain point for me. Because most of my time really does go into educating the prospect first and educating the clients that, why actually marketing is important and has a role to play in your organizations. So one of the major challenges, again, is about the awareness. I just think healthcare, historically speaking, it has been it has lagged behind in adopting new trends. But even for healthcare communication and marketing, healthcare just doesn't get it right now. They don't think it's important to be on social media. They don't think it's important to have their digital access points covered. And this is, but again, we have to take our lead from these big tech companies as well, right? So when I talk about a healthcare organization, I mean healthcare companies. I'm talking about hospitals, I'm talking about private practices, I'm talking about pharmaceuticals, medical device companies, life science companies. Everybody needs to meet their customer where they are. And where is everyone? They're online, they're on social media. The first thing they do is Google. And this is actually where I give credit to Google as well. This is these big tech companies like Apple, like Amazon, like Google, they're actually going into healthcare, right? So they're acquiring these medical companies. They're providing features on their platforms to make things easier for their patients. So again, number one, awareness, is that lack of awareness. Number two, I think there's a big concern about ROI. So everything obviously is sort of, I guess, measured in terms of money or the cost or the investment. But studies do show that people who invest in marketing and have a budget, a specific allocated budget to marketing, they do see a positive ROI as well. So I think these would be the two major challenges that constantly have to educate clients on.
Yeah, it makes a lot of sense. I've even heard the same things from very clients that I had approached as well. And I guess everyone's got to different, background, and everyone's experience is, quite unique. Mine is sort of the fact that I never really had any professional working experience abroad. I went abroad for my education, but I came right back to Pakistan to help launch a healthcare startup. And that too, it was off the back of a family business that had been involved in healthcare since the formation of this country. And I, for one, feel that dealing not just, with Pakistani healthcare companies, but dealing with Pakistani companies in general is an art in and of itself. Have you felt that same experience dealing with Pakistani healthcare companies as opposed to, healthcare-oriented brands from abroad?
Yeah. So that's again, a really good question. So, there are some universal challenges, right, which are same across the board, right? But in Pakistan, considering, the socioeconomic challenges that it has, the political, the cultural sort of challenges it does have its unique sort of challenges, and it is unique in that manner. So I have found that, if you were to ask me where I see health tech in Pakistan right now, I think it's very vibrant. I think there's no shortage of talent. I think there are a lot of passionate and dedicated people working in health tech right now. But again, let's get back to the fundamentals, right? Let's get back to the grassroots challenges that we have. Provider access, number one. The primary healthcare, I'm not even going to talk about high-level things. I'm just going to talk about primary healthcare in Pakistan, where there's not only a shortage of doctors, but there's also our population is exponentially increasing, right? And so that gap is just getting wider. And this is, I think, where we can actually leverage technology the most. So, people say that, well, it's a resource-poor country and they won't have the budget or they won't have the resources. But I think in developing countries, the need for technology is just so much more important, just so we can narrow that gap. And that brings me to my next point is that, again, we have all these amazing people, all these amazing products in different segments of the healthcare ecosystem, but we can't work alone. We can't work in silos. We have to come out, we have to collaborate, we have to, come up with interoperable solutions. And that takes it the next step further, which is something that I talk about all the time as well, is clinician-guided processes and clinician collaborations, because again, like myself, this is actually one of the premises on which we built or we formed Xeven Health, like me and my colleague physicians, because we found that gap and we know that gap in the market exists. And so whether that's in tech, whether that's in marketing, whether that's in communication, whether that's in insurance, we need people from that industry who understand the product better, who understand the patient provider journey, who understand the patient psychology, to be at the forefront of these processes and to be leading these processes, if that makes sense. So.
Absolutely, it makes sense from a collaborative standpoint, and it's very funny. Every time I go to a conference over here, they're like, in order to improve health tech in Pakistan, you need people from the IT sector, you need people from academia, and you need people from the industry, and you need people from the government. And ultimately, right, and this obviously applies to people like yourselves, who are first and foremost businessmen or even marketeers, is that they're the people or the entities that have historically been involved in the business of healthcare are oftentimes ignored. And in a lot of cases, their opinion probably matters the most, because they can tell the person who's been studying a particular field of healthcare technology in the realm of academia whether there's practicality for it or not. They can tell people in the government or from an industry whether there's enough consumer demand for that item. They can tell people in tech that, right, obviously you're going to be spending a lot of time. That's why there's books out there like the Mythical Man Month that teach people or tell people how to allocate resources in a given amount of time as to whether what they're doing is worthwhile, whether there's a demand for it. It's like, most telemedicine, not telemedicine, but most EMR providers in the beginning suffered quite greatly because they went to doctors and the doctors were like, this is quite awesome. And theoretically, it makes sense that a doctor would want, a record management system. But at the same time, it's not really something that they might need it. But at the same time, right, the whole beauty of having a patient come in and pay in cash is so that,
well, again,
that you don't need a system like that.
Yeah, like they might use it, but it doesn't integrate within the clinical workflow, right? And this is
exactly.
where because there's again, I was also talking to one of my guests on my podcast, and he said it so beautifully that there's a workflow on paper, but then there's the actual clinician workflow in which we have to handle administration. There's paperwork. There's all those other things as well. So you need to consult the people that are the end users. And clinicians are one of the end users. Patients are, of course, they're the external end user, but internal end users, I would say that clinicians and all the other healthcare professionals, absolutely, they should be a part of the conversation.
Absolutely. And that brings me to my next question. And if you could answer this as briefly and concisely as possible, that would be appreciated. How can we use health tech to improve the state of healthcare in this country? Could you possibly refer to a use case that's been implemented in another country?
Okay, so again, I'm going to go back to what I said before, that, first of all, provider access. So we need more virtual care tools out there. In order to adopt, let's talk about actionable points, right, or actionable items. So in order for digital adoption to increase or to be more sort of second nature in Pakistan, that comes along with digital literacy. And that also comes along with digital health literacy. So what that means is basically empowering the patient to be able to find, access these tools and information and resources to apply it on themselves and better the state of their health, right? Through electronic sources. Because again, we can divide it into compartments, right? So we have the 70% rural population who struggles with basic needs and internet penetration. And this is, I think, again, where we can involve other sectors as well, like the telecommunication industry. But then we have the urban population as well. So who are already on their smartphones, they're using their apps and everything. But again, even a lot of the urban folk, they don't know that telemedicine exists. I still see a lot of telemedicine companies using influencer marketing, for example, to sort of amplify, enhance their message. So I think that just to normalize this, again, it boils down to marketing, it boils down to awareness and using technology, not only for patient care, but then again, for patient communication and to meet the patients where they are. So provider, of course, primary care, provider access, then we have your pharmacy system. I mean, I know you guys are doing such a great job, Elaj, I've seen, I read your updates and everything else, but I think it's so important I am so glad that part is also digitized, right? And that part is also automated, and that just makes the patient journey so much more easier. So again, but it brings me back to my point that interoperable solutions, just so the patient should be able to navigate any segment of the healthcare ecosystem from one access point, right? So yeah, that's where I think.
That's great. What is Xeven Health vision going forward? And what are some of your biggest success stories to date?
Yeah, so like I said, the premise of Xeven Health is really about, the founders are clinician, me and my colleague, Dr. Tazeen. So we founded it because we saw this gap in the market, and we wanted to provide clinician-guided collaborations in whether it's tech, whether it's marketing, or whether it's along any point across the healthcare continuum. So one of the things that we're very passionate about is healthcare education, health literacy, and digital health literacy. And it's something that we talk about, and we make all these neat infographics and everything. I mean, we're pretty active on LinkedIn as well. And this is just information that we're giving away for free. Why? Because that's what we want to do. That's where we think that we can sort of start our awareness campaign. So when we're keeping in mind, consultation, advisory, and I don't want to go through all like the services that we have, but our vision is to make healthier populations through awareness and education. And one of our efforts actually in that is that we're launching a digital health course, a foundational digital health course very soon. We're in talks with universities in Pakistan as well. And so this is because I think when we talk about, I'm just going to plug it in here, but when we talk about stakeholders in the healthcare ecosystem, we need to understand that medical students are one of the most important stakeholders in this in the healthcare ecosystem. That's where it actually starts. And so I wish I had some knowledge about health tech when I was a medical student. I only recently found out, but I think this is just going to be such a phenomenal sort of breakthrough when we start it at that level, because they need to be aware of the evolving landscape of healthcare. And I think that's really where we can make an impact, starting at square one and moving forward. And hopefully 5 years down the line, we won't be having the same conversation.
Absolutely. And what you said about how medical students are ultimately the most important target demographic really struck a chord. Because when I was, Elad is the amalgamation, or actually the merger of a e-pharmacy and a telemedicine company. The e-pharmacy was known as Say It. So I did conduct a few guerrilla marketing campaigns where I'd hand people with brochures to, hand that literature off to different people they see on the street. And they didn't have to visit different locations. And they found the most receptiveness to be amongst medical students. But then again, right, it's also, this obviously is an aspect of marketing. There's also an aspect of amplifying the user experience and maybe simplifying it to the end consumer. It's like, for example, I was doing some research on how the mouse and the keyboard were developed. And these were devices, obviously, that you had to kind of use to use a computer. And the mouse itself had a very complicated name that was at least 3 or 4 words. And then it literally took a team of researchers for a particular department that you couldn't really say fell under UI UX, but more or less consumer demand, and which required, focus groups, and then, seeing how easy it was for not just a customer to use a particular device, but to identify with it. And that's how the name mouse came up. So I think that's sort of like a very interesting point, that this space and whatever products or service offerings exist in it need to be simpler for the end consumer to understand, even if he isn't from a medical background. And I think that's what essentially will have everybody use telemedicine portals and going forward in the future. So that comes to my very last point. What is your one message for those willing to learn more about health tech in Pakistan, so that you feel?
So first of all, there's a lot of it. I think we live in a day and age. We're lucky to live in a day and age where we have so much information available to us at the click of a button. There's a lot of information out there. I think this is, for anyone who's listening through this platform. And again, thank you for the opportunity. But something that for female doctors especially, who don't get to pursue clinical medicine or mainstream medicine, or just are looking for alternative career paths, I think health tech is definitely something that they should dive into. And even in health tech, there's different disciplines and different sort of pathways that you can get into. And I think connect with people. I think I live on LinkedIn, so I'm just going to promote LinkedIn here. I think that networking is so powerful. I've met so many amazing people through it. And I really do believe that, once you start looking for answers, you'll start attracting the same sort of energy. So again, start networking, keep up with, evolving healthcare trends as well. That is something that Pakistani medical students are left behind because of the traditional sort of curriculum that we have going on. But again, which is why we have taken this step as well, Xeven Health, and we're launching our digital health course, and then, listening to podcasts like this, right? So, we started the Plus podcast, and you started this health tech. I think it's an excellent initiative for people. Again, you're using the message as a medium, right? So you're using this platform. And
it also comes to a specific target market. So our target market is the corporate sector of Pakistan. Your target market, could either be the general public or a particular demographic you have in mind.
Yeah, absolutely. Yeah. So that's my key takeaway. I think that if you really want to, there are other options out there for students who want to explore. Definitely.
So yeah, I just looked up what the mouse was originally called. Are you ready?
Yeah, go ahead.
It was originally called an XY position indicator for display system.
Wow.
And it had to be reworded a mouse so it could be more, consumer friendly. Exactly. It's a mouthful, actually. Anyways, thank you so much, Dr. Maida, for coming on the show.
No, thank you so much for the opportunity, Bilal. I hope we can do this again.
All right. Take care. Have a good
Take care. You
weekend.
too.